Hello, I'm Nat Thorne and I'm a bioinformatician by training, and I've learned the hard way that data management in healthcare is a completely different ballgame compared to bioinformatics or even clinical bioinformatics. So the essence of what I've learned about genomic information management in healthcare is summed up in this short webinar called Genomics on Solid Ground, the Pyramid for Precision Medicine. So I'm going to give a recap on what a genomic information management system, or GIMS, is. Then I'll go over the pyramid framework for building a GIMS. And then finally, I'm going to break it down and go through each part one at a time. So a GIMS is a genomic information management system, and it's built specially for genomics in healthcare because genomic data is just too big and too complex for existing health IT systems. A GIMS manages genomic information that comes from all the steps of a genomic test, from consent and ordering to sequencing, analysis and reporting, and it needs to connect with both clinical systems as well as genomic systems. So every discovery starts with a strong foundation, and we developed the GIMS Pyramid as a framework for building those strong foundations for managing genomic data. Building from the ground up, each layer supports the next because the structure and the standards that we have in place today means precision healthcare becomes possible tomorrow. So the end game here is precision healthcare, better outcomes for patients. But to get there, we've first got to build the foundations to support it. And without the proper systems for genomic information management, it's just not possible to store, analyse and reuse data in a way that's going to be needed for precision healthcare, at least the vision we have for precision healthcare. So just like Maslow's hierarchy of survival, there are basic needs that need to be in place first. And so I'm going to refer to that as the genomic hierarchy of needs. The genomic hierarchy of needs starts with data governance, including data privacy, and of course, cybersecurity. Then we've got orchestration, so the ability to move data through complex workflows. And then data availability, because the data needs to be stored in a way such that it is available when it's needed. And all of this is happening within the context of healthcare, so it needs to be interoperable. And then there needs to be the ability to reanalyze data and connect with research infrastructure. And so finally, you would have the building blocks for enabling precision healthcare. So let's go through each layer of the GIMS pyramid in a little bit more detail, starting with genomic data governance. So there's no point in having a system if we're not clear who, what, where, why, when, and how we're going to be using the data. So we've got to get the roles right first. And to do that, we've got to test out the assumptions, we've got to prototype, really spend time designing the system properly before starting to build the real system. And with Genomical, we worked for several years with health data governance experts, with medical scientists, clinicians, bioinformaticians, IT leaders, patients, consumers. We didn't just go and pick a data governance framework off the shelf and stop there. We really leaned in and thought about what was going to be needed for genomics in the clinical setting. Things like, how should data sharing be governed between laboratories who are doing genomic testing? Who's responsible for what? And what should Genomical be doing to enable this? What's our role? We brought a genomics lens, if you like, to privacy as well. And we even developed genomic-specific privacy training with expert privacy consultants. So all Genomical users have to complete it before they can start even using the Genomical platform. Our data governance framework for genomics has gone through many iterations over the years, and it absolutely underpins everything that we do. The next layer is cybersecurity, and really this is something you can't retrofit. It has to be baked into the design from the outset. People call it security by design. and it's in every step all the time. Design, develop, implement, test, adopt, operate, maintain, all the steps. So yes, you can improve security as you go along, and you should, but it really has to be there from the beginning. And it's not just about the technical controls that need to be there. It's because security has to be part of who we are, our culture. And without this foundation, who knows what you're missing? It'd be practically impossible to catch up if it wasn't a core priority from the start. If you're treating cybersecurity as a tick box exercise or something that someone else is doing, there's an IT department that takes care of that, rather than something that's embedded into everything, then you're not quite doing it right. So in the context of managing genomic data across the data lifecycle, you can't just rely on security of the software components that you're using, a particular tertiary analysis tool, for example. The whole system connecting them needs to be secure. So genomic data security is a whole of system, whole of lifecycle problem. It's much bigger than just, can I securely store the data? It's not an afterthought. It's really about being a foundational layer or foundational aspect of how genomic information management systems are designed. So the next layer is about the data and how it's going to be moved around or orchestrated. So genomic data is big and it's really complex, and it needs IT systems that are designed and are fit for that purpose. So in Genomical, we have a genomic orchestration service that we call GOS, and it's literally the heart of the GIMS platform. Without it, all we really have is a secure genomic data repository. And here's where things get interesting, because technically you could get away with some bash scripts or some low-code solution, if this, then that, transform this, upload that, and you could get something up and running pretty quickly. But eventually you're going to come up against two unavoidable challenges. The first is that this custom code, these point-to-point integrations, will create quite a big maintenance problem. It's going to become harder and harder to make the code fit across multiple point-to-point integrations and keep it updated. It's going to be really hard to implement DevOps, or that automated way that you develop and deploy and make changes. So these modern software practices where you're automating your builds, you're automating the way that you're testing your software, automating deployments, consolidating all the logging, monitoring, and vulnerability scanning into a wholly integrated system, all of that is going to become just too hard. So what might have started as a quick solution will over time become quite an unmanageable spaghetti mess. The second challenge is that genomic data management, it isn't simple. It doesn't follow ETL rules or simple data patterns. These kinds of things work well for low code and point-to-point sort of solutions, but genomic data requires complex integration. So what do I mean by that? Well, to get data from one third-party software to another efficiently requires connecting disparate systems in a unified way. So GOS enables a true system-to-system integration for genomic data, and it's literally taken years to design and build this, because we really had to have a very comprehensive strategy that was needed to mean that the way that we connect with different kinds of genomic software, different systems, is done in a way that's scalable and efficient, and we can still automate the way genomics is managed in healthcare. With genomic-specific data governance and the cybersecurity, the data orchestration in place, the next foundation is going to be to make sure that the data is available. So availability is essentially the forgotten pillar of the security triad. This is about the systems that store the data. And we all remember the other parts of the security triad, confidentiality and integrity. But these are the way that we stop unauthorized access and we prevent file corruption. But we forget that security also means being able to get the data when it's needed by those who are allowed to. That's a data availability. In the genomics world, we talk about fair data principles, which include being able to find and access the data. So hiving off the data and storing it somewhere without any real intention of being able to easily and safely access it isn't really good enough. So we have to think about how we store the data so that it's available when it's needed. And without this, not only are we ignoring a key principle of best practice security, but we're also wasting resources by not recognizing the value of the data and going to the effort to store it in a way so that it can actually be reused. So it's super important here that we know that data availability, it doesn't mean that the data is now a free-for-all. It's not available for just anyone whenever they want. What we mean is, if we bother to store it, if we value it, then we should make sure that the system is working when we need to retrieve it, and we should make sure that we can easily find it, get it, and then understand how we could use it again. The next level is interoperability. Information needing to be passed between systems, exchanged and understood through a common model. For interoperability, it's not just about having a common model that's written down somewhere, it's about actually using it. It's about implementing standards into each of the relevant systems so that systems are designed around those common models and the common model gets properly road tested in the real world. So it's not just a theoretical set of standards. In Genomical, the APIs that have been developed are based on FHIR, the Fast Health Interoperable Resource, one of the health system messaging standards. And so Genomical is a system that's specifically designed around these FHIR bundles. It's absolutely a cornerstone of the system. Does it make it a little bit complex sometimes? Sure. But for the long-term future-proofing of Genomical, it's a must. It means Genomical is designed to talk to other health systems that also speak FHIR or HL7, like LIMS systems or EMRs, for example. Or it could talk to FHIR-enabled genomic ordering or FHIR-enabled consent applications, all of the health IT systems that will be the building blocks for genomics will need to speak FHIR or HL7. Unfortunately, genomic software tools don't talk FHIR, but that's where the beauty of GOS comes into it, the Genomic Orchestration Service, because it effectively creates genomic interoperability. It handles the complex integration between genomic systems, reducing the exponential complexity of talking to multiple different genomic tools. So Genomical is health interoperable and Genomical creates genomic interoperability. So labs can connect once, access many genomic tools, just as if they were using a common genomic model. GOS effectively creates the common genomic model in the middle. And when I mean common model, I don't mean a standard for what the VCF file looks like. I mean a standard for how genomic systems talk to each other in order to make them work across a workflow. And this is also quite different to running a bioinformatics pipeline. With interoperability in place, the next building block of the GIMS pyramid is reanalysis. So if we have the governance to know when, why, and who can access data, and we have the security in place to protect it, the availability to find the stored data, the orchestration to manage different disparate systems securely, and we have the interoperability to work within healthcare with the healthcare messages and multiple genomic tools, then we have the precise ingredients for being able to reanalyze data. So with an enterprise GIMS like Genomical, we can do reanalysis as part of routine genomics. It means patient genomic data isn't being ferried around on USB sticks and Excel sheets aren't being emailed between organizations. What it actually means is that reanalysis can be done safely using genomic data that can actually provide answers to patients that maybe were originally undiagnosed. So the exomes and genomes can be reanalyzed for new clinical purposes as well over a person's lifetime, obviously with the right consent. So this is pretty critical, huh? Like, we're storing genomic data for the purpose of healthcare. But not only does the reanalysis need to be done within the lab sometimes, as patients move around or because different labs have different testing services and expertise, just as labs have sendaways or referrals, data may also need to be shared between labs. That's where organisational interoperability comes into it, and Genomical enables this too. With the foundations in place to safely access and reuse data, the next layer is now possible: access for research. In a clinical grade GIMS like Genomical, the data should never be analysed in a production environment for research purposes. What we need is an airlock system or a trusted research environment that can be used to provide a separate place for researchers to do their analyses. What this means is that the source of truth, clinical genomic data, retains its integrity within the healthcare system, remains protected, but can also be accessed in a separately governed research environment. And finally, when all the levels of the pyramid are in place across the health system, precision healthcare is possible. And what this does is it opens up a whole new host of new possibilities. Genomic data that's generated in healthcare is now available across the life course. It can be shared for research, and it can inform innovation in clinical genomics. I hope you've really enjoyed this short webinar on the Genomic Information Management, or GIMS Pyramid, and I hope you learned something about some of the challenges and solutions that we have for managing genomic data in healthcare.